Disaster, a sudden ecological phenomenon of sufficient magnitude to require external assistance. WHO definition. According to the Center for Research on Epidemiology of Disaster, that is CRED, Center for Research on Epidemiology of Disaster, hydrometeorological, geophysical, drought, pandemic. In humans, non-intentional, intentional, earthquake, that is non-intentional, intentional, race, ethnic, in Manipur, terrorism, chemical, nuclear, and also there is visual and team. Sometimes post-traumatic stress disorders are there. So forensic odontologists, doctors should be there. Triaging, a morgue station, antemortem team and postmortem team, setting up of a temporary mortuary, and a automated fingerprint system, that is 10 for criminal, 6 for civil points, automated fingerprint points, and Aadhaar card, lottery, jewelry, clothing, personal items, jewelry, clothing, height, weight, Aadhaar card, lottery. Okay. Next is another thing about this this AI in artificial intelligence and disaster victim identification, that is face recognition and matching, data integration, pattern recognition, automated analysis, predictive analysis, 3D reconstruction, improved efficiency, global collaboration, training and simulation, ethical and legal consideration. Next is in a mass fatality incident, natural and non-man-made is there. Natural weather-related problems, fire, tornado, mudslide, hurricane, flood, and disease. In man-made, criminal and non-accident, fire, criminal, fire, terrorist shooting, a stampede, accidental transportation, fire, bridge collapse, structural, that is train, bus, automobile glass, and marine aviation, disaster victim identification. Process changes, cultural and religious consideration should be there, legal and jurisdiction requirements. Planning a disaster victim response, summarizing the phases of identify the victim. There is scene, anti-mortem and post-mortem X-rays, DNA processing, security risk, reconciliation. Okay. Then is about the disaster victim protocol, triage, relieving the body, screening, radiology, photography, antemortem, postmortem, data collection, coordination, DNA, fingerprint, anthropology, personal effects, postmortem findings, forensic odontology, radiology, identification, review team, body release. If positive, identification, body release. If not, identify, return to holding facility for final disposition. Next is about the postmortem line, fingerprint room, autopsy room, DNA table, X-ray, final test. We can estimate the stature of a person, length of the skeleton plus 2.5 centimeter from the thickness of soft parts. And the body is extended, the distance between middle of the middle finger to another middle finger. That is the distance from 20 to 25 with the vertex to the big symphysis into 2. Aim. Arm is lengthened plus L into 2 plus 34 centimeter olecranon process. River for the stage. Sternal notch distance from the sternal notch in the pubic symphysis 1/3 of the stage. Deformities, birthmark, occupational mark, tattoo mark, serology age. In complete non-decomposed body, complete non-decomposed blood can be taken. But in mutilated non-decomposed body, blood and also 10 to 15 gram of deep skeletal muscle tissues can be taken. Complete decomposed or mutilated body, large bone 4 to 6 into 1.1 to 2.5 to 1 centimeter, molar and upper lower canine, Numbering system should be there and bodily parts A to A, B, C. Formalin should not be used, it destroys the DNA. Freezing. Dry ice can be used at a mass disaster in India, Goa. Medical infrastructure, medical this is disaster organization is there. Thank you.